We're with Lisa Brown, an advisor at Brightworth in Atlanta, and Lisa is an expert in the economics and cost of health care. So Lisa, tell us, what is it about the new health care regime in the country that most advisors don't know how it affects their clients?
Well, I think one of the key aspects, Evan, is that one of the provisions as part of the Health Care Act is that anybody who wants health insurance can get it regardless of their medical history. And particularly with our high income, high net worth clients, in the past, they may have been hesitant to retire early, let's say retire before 65, before they could get on Medicare, because they were concerned about the cost of buying individual health insurance for themselves or even qualifying for it if they had a medical condition. Well, now, as part of the Affordable Care Act, they can go get their own health insurance policy to bridge them before age 65, even if they're in very poor health. So it gives our clients more freedom to retire early and be less constrained by what their medical plan is going to be.
Well, that's one of the bright sides of the healthcare. What about the costs, or the hidden gotchas in there?
Yep, there are some gotchas for our clients. One of the areas that I spent some time talking about today was the new surtaxes as part of the Health Care Act. There's an extra 3.8% surtax on our clients' portfolio income if they make above a certain amount of money each year. And there's a 0.9% Medicare tax on their wages, assuming their income is above certain thresholds each year. So also those who have individual health insurance policies, they may have seen their premiums go up by about 30% this year, and that's because as part of the Affordable Care Act, all policies with an effective date of 2014 or later have to cover certain levels of care, certain benefits, and so the health insurance companies have increased premiums on certain products, which is flowing through to our clients' bottom line.
Well, one thought is among many people in pre-retirement is once they reach Medicare eligibility age, then sort of the problems go away because they're on Medicare. Is that an erroneous assumption?
That is an erroneous assumption. One of the other aspects for your high income clients when it comes to Medicare is that they are paying more for their Part B and Part D premiums on Medicare if their income is above certain thresholds.
What's typical income threshold?
So for a single client, if they make more than $85,000 a year, or for a married couple that makes more than $170,000 a year, they're going to be paying more for their Medicare Part B and Part D premiums. And to make matters worse, those AGI thresholds are capped until 2019. So more and more clients are going to be falling into the situation where they're paying more and more for their Medicare Part B and Part D premiums.
And the Social Security income count as part of that 170,000?
It does.
So if they're taking the minimum distribution from their IRAs, if they're well funded, this could easily put them over that limit.
That's right. What you need to look at is the last number on the front page of their tax return, which is their adjusted gross income, their AGI. And that takes into account all of their income, their portfolio income, their pensions, their IRA distributions, their Social Security, annuity income, all the different sources of income they have. When that all boils up together, if they're crossing those thresholds, that's going to impact what they're paying for their Medicare premiums.
And what kind of advice are you giving to them? Well, even what should advisors be doing in case that their clients will be hit with Medicare costs or healthcare costs that are higher than they anticipate?
Well, I think there's a couple things. One of the things I really recommend advisors do, and we do it for our clients, is we map out 5 years of cash flow for their client. We look to see where their income's coming from, what are some higher income years they might have coming up. That allows us to at least forewarn our clients, hey, you're going to have some higher medical expenses, medical premiums in certain years. We need to then, as advisors, understand how much income we need to be generating off that portfolio so our clients can keep paying their bills in retirement. And that's what really is important to clients. They don't like to have erratic income in retirement or erratic taxes. So if we know that these higher medical expenses are coming or can plan for them, that can help us structure our clients' portfolios better. Plus, as you're mapping out 5 years of cash flow, I tell advisors, don't be afraid to inflate the medical expense line item in the client's budget by 10% or more a year. They could easily see their medical expenses go up much higher than the average cost of living. And again, that impacts what their withdrawal needs are going to be in retirement, how we need to manage our client portfolios so they can meet their needs.
It looks like an expensive future ahead.
It may be, but there's a lot that we can do as advisors to help minimize and mitigate the impact of the Health Care Act for them and just help them be more strategic with the resources they have. And obviously, minimize taxes. That's, clients win if they can keep more of their own portfolio, and the advisors win if they can keep more assets in the client portfolio and less going out in tax.
Lisa, thanks so much for those insights.
You're welcome.
At the IMCA Annual Conference in Boston, this is Evan Cooper for Asset TV.